E-pills were originally designed only for short-term treatment. And over long periods, especially in older adults, PPIs create a chain reaction that can unsettle the heart in ways most seniors never hear about. The trouble begins with magnesium, a mineral your heart relies on every single second of every single day. Magnesium keeps the electrical rhythm of your heart steady and coordinated. It is the conductor of your heart's orchestra. When levels fall, the rhythm falters. Beats become irregular. Palpitations appear. In severe cases, the heart's rhythm can go dangerously off course. PPIs reduce stomach acid so effectively that magnesium absorption begins to drop. Slowly, quietly, month by month. And because aging already reduces nutrient absorption, older adults are especially vulnerable. Most people don't feel magnesium deficiency at first. Maybe a little more tired. Maybe some cramps. Maybe dizziness. But deep inside, the heart's rhythm is losing stability and the electrical signals become less predictable. Some research also suggests that long-term PPI use may reduce nitric oxide, a molecule that keeps blood vessels relaxed. When vessels stiffen, the heart must pump harder. Over time, this leads to increased strain, exhaustion, and vulnerability. Yet millions of seniors take PPIs for years, sometimes decades, without a single conversation about whether it's still necessary. The pill that protects your stomach may quietly be undermining the organ that keeps you alive. If you rely on a PPI daily and you're over 60, this is the moment to ask important questions. Do I truly need this long-term? Can I taper? Are there lifestyle or diet changes that can reduce reflux? Because your heart deserves protection just as much as your stomach. And if a stomach pill can create this much disruption, what about a common cold medicine? 3. Oral decongestants. These cold pills can squeeze the life out of an aging heart. For older adults, a stuffy nose seems harmless. But what many don't realize is that decongestants containing pseudoephedrine or phenylephrine constrict blood vessels not just in your nose, but everywhere in your body, including your heart. When blood vessels tighten, blood pressure rises. For someone already managing hypertension, this sudden spike can be dangerous. Many seniors describe feeling their heart suddenly pounding. Some feel tightness in their chest or dizziness. Older arteries are less flexible. That means a sudden increase in pressure hits harder and lasts longer. Every winter, hospital emergency rooms see older adults whose heart symptoms were triggered by nothing more than a cold pill. And yet, these medications sit on store shelves, easily accessible, without any warning tailored to seniors. The safest option for older adults is to avoid oral decongestants entirely and choose gentler alternatives. But if a cold medicine can strain the heart, imagine what can happen with older antidepressants, especially when taken for reasons other than depression. 4. Tricyclic antidepressants. These older medications can upset the heart's electrical balance. Many older adults take tricyclics like amitriptyline not for depression but for nerve pain, insomnia, or chronic discomfort. But as the body ages, these drugs begin to interfere with the electrical signals that coordinate each heartbeat. They slow conduction, interrupt rhythm, and increase the likelihood of irregular beats. They also lower blood pressure when you stand, a dangerous effect for older adults. A sudden drop can cause falls, and every cardiologist knows that a fall in an older adult can begin a devastating decline in overall heart and physical health. Tricyclics also raise resting heart rate, forcing the heart to work harder even while you sleep. Over time, this constant overworking can leave the heart tired and unstable. The danger is not dramatic. It's slow. It's silent. And because many seniors have taken these medications for years, they often never consider that the old pill they trust may now behave differently in their aging body. And if a prescription drug can quietly harm the heart, what about something that doesn't feel like a medication at all? 5. Calcium supplements. These daily pills may slowly harden the arteries of an aging heart. For years, older adults were told to take calcium to protect their bones. But when taken in large doses, calcium supplements can cause sudden spikes in blood calcium levels, spikes that older blood vessels cannot regulate well. Unlike calcium from food, which enters the bloodstream slowly, supplements enter quickly. Too quickly. The body responds by depositing excess calcium into artery walls, which leads to arterial calcification. Hardened arteries force the heart to push harder. The workload increases. The heart strains more. And for seniors with existing risk factors, the danger grows. The signs are subtle. Shortness of breath, fatigue, heaviness in the chest. But inside the arteries, stiffness is building. Pressure is rising, and the heart is aging faster than it should. This does not mean all supplements are harmful. It means seniors deserve medical guidance, not guesswork. Final reflection: what all 5 of these risks really mean. After exploring these 5 hidden dangers, one truth becomes clear. As we grow older, medications do not behave the same way they once did. The aging heart is more sensitive, the kidneys more cautious, the blood vessels more fragile. A pill that once helped can, decades later, quietly become harmful. This doesn't mean you should fear medications. It means you must understand them. It means every senior deserves a doctor who listens, a pharmacist who explains, and a health plan tailored to an aging body. It means being brave enough to ask questions and wise enough to observe the signals your body tries to send you. Your heart has served you faithfully for decades. It deserves protection, awareness, and thoughtful choices. And now that you understand these risks, you're already taking a step towards safeguarding your future. If this message helped you, comment 1 below. If not, comment 0 so I can give you even better guidance next time. Thank you for watching, and remember, knowledge is one of the greatest tools you have to protect your heart and your life.